So if you guys know me, you know that I have some serious big feelings around the flu. I have seen children that have recovered super well. I have seen kids that have needed to be hospitalized. I have seen all kinds of things from kiddos needing oxygen to kiddos needing full on support in the hospital to get them through. And so for that reason, over my 19 years of practice, I have some big feelings. So I am here to normalize your uncertainty. It is one of the hardest parts of flu season is just that we can't always predict like which kids are going to struggle more and less. So today I want to walk you through actually what the flu is, when to worry, when not to worry, how to support the body both conventionally and holistically through recovery. And if you don't know me, I'm Dr. Ellie, and my practice is Middle Path Integrative Pediatrics. I'm in Asheville, North Carolina. And if you want to hear more about the flu, sign up for my newsletter because I just did a whole thing on it, and you will want to get that on my website, middlepathintegratedpediatrics.com. Let's dive right in. So what is the flu? Okay, so my purpose here, you guys, is just to try and help you differentiate from colds because colds are super similar. And I just want to educate you so you're not completely overwhelmed trying to decide if this is flu or not. Just so you know, influenza is like a viral respiratory infection. So you can't treat it with an antibiotic. If you do like pharmaceutical medication, you have to use kind of an antiviral. So we'll touch on that later, but just to kind of throw that in there. One of the big differences, you guys, between colds and flu is just that flu really hits a lot harder. So you might think of something like cold, like just kind of like runny nose, but your kid's kind of running around, still eating, kind of still doing things, not overly bugged, maybe a little uncomfortable. But with flu, you've got these high fevers, you get chills, sometimes just the worst body aches, fatigue, headache, cough, sore throat, and even GI symptoms, especially in kids, you guys, they can get all kinds of like vomiting, nausea, sometimes diarrhea. So it can be pretty miserable for little ones. People that are like at higher risk, in my world, infants are at higher risk for developing complications from the flu. So you do want to check in if you have an infant that you think might have influenza. And I know there's a lot of pregnant mamas out there who listen to this. So y'all, if you're pregnant and you get the flu, definitely check in with your OBGYN, your midwife, PCP, what have you, and make sure you're doing okay. And then another group of individuals that I kind of worry about are kids that have chronic illnesses like asthma or immune deficiencies, heart disease, things that would put them at a higher risk of getting more sick when they were infected with the flu. That said, most kids do recover just fine. It's just knowing who needs closer monitoring, maybe more care, all of that. Okay, so that's what we're sort of getting at. So how can you kind of support this at home? How can you do some kind of core supportive care and see, if you can kind of battle through it and get better? So some of the things you can sort of do are simple but not easy. Okay. I always say simple, but not easy when it comes to lifestyle because sometimes we sort of poo-poo them, but they're so important. They're really the foundations of everything. And without these key pieces, doing all the supplements and all of that, those are great, but it's just not enough. Okay, so we need the foundational support. So the number one foundational support we're going to do is rest. So our immune system actually does need rest in order to recover. So it needs it. It needs us to not be doing strenuous sports. It needs us not to be pushing through exams. I know this can be really hard in teenagers, you guys who want to do all the things even while they're sick. But it's just going to make them worse. And, also there's that whole part about being contagious. It's kind of, we don't want to spread it to other people. And then we do want to stay home until we're at least 24 hours fever free. Okay. Another thing we really want to do is good hydration. So this is absolute gold, you guys. We need to get fluids. So under 6 months old, for infants under 6 months old, we want to feed with breast milk and formula. So don't try and jump in with a bunch of extra fluids like water or teas or things like that, because it's just not really appropriate for their age group. And so we want to just keep hydrating with breast milk or formula. For 6 to 12 months old, you can do small amounts of water. If you feel like they're not getting enough from their breast milk or formula, of course, we want to be age appropriate. So check in with your pediatrician as to how much. You can do a little herbal tea if you want to, but it's got to be cooled, of course. So things like chamomile can be quite calming. You can use bone broth, but you want to make sure there's not a ton of salt in it or you've used vinegar. I don't know why you'd put honey in bone broth, but no honey under a year in any case. Okay, over a year old, make sure your kids are getting all of those goodies. So if you have a toddler that's still breastfeeding or using a little formula, of course, give it. If not, make sure they're drinking water. They can do dye-free electrolyte drinks. There's plenty of great homemade electrolyte recipes out there that you can use. But if you are purchasing one on the market, you just want to make sure it's not got a bunch of junk in it and dyes and all of that. Okay. Again, herbal teas and broths are super important in this age group, so highly recommend it. One little thing, sugary drinks, Gatorade, Powerade, soda pop, those are not great to give because the sugar actually does increase inflammation in the body. And if your kiddo has GI symptoms, it can worsen diarrhea. And I know, I get it. There are certain times where like your kid will not drink anything but I understand, but in general, avoiding those things is really great. Clear emergency. So how do you know if your kid's getting dehydrated? There's a couple ways, but the number one thing I want you guys to look for is their urinary output. If they are peeing as they have been normally peeing in their life, they're likely not dehydrated. But if you have a baby that's still in diapers, toddlers that's still in diapers, and they're having 2 or less soaked diapers in 24 hours, they're dehydrated. So that's an emergency. You need to seek urgent care. Or if they're crying and they're not having wet tears as they normally would, or if you look inside their mouth and their mouth is really dry, that can be another reason. And then there's like a clinical sign called capillary reflex. Refill, sorry. For all of you like clinicians out there, nurses, you'll know what that is. But essentially you'll pinch your child's finger, it'll blanch, kind of turn more pale, and then turn back to their normal skin tone really quickly. If that's happening, that's a good thing. Thumbs up to that. If it's not happening quickly, 3 seconds or more. So if it's blanching, staying not their normal skin tone for 3 seconds or more, then they are dehydrated. So you need to take them in somewhere urgently. If you're not sure, absolutely reach out to your holistic pediatrician. Okay, I want to talk a little bit about fever just super briefly. I did a whole other podcast on fever, you guys. We're going to link that in the show notes if you want to know more on fever. But essentially, fever is part of the normal immune response. So we're not trying to, squash a fever necessarily. That said, if you feel like your child is so uncomfortable, they just can't sleep, they cannot eat, they cannot play, they are just absolutely miserable, then of course we want to treat a fever. Simple things would be like a lukewarm bath, never ever freezing cold. Okay, that is not good. Like lukewarm. Or just like, sponge baths just to kind of cool the body a little bit. Some people do like the wet sock treatment. Just be careful not to leave the socks on for too long because the skin can get kind of yucky if we do that. But, just for a few minutes, that's fine. And then in the homeopathic world, they use the bryonia, of course. You can always ask about that. And then medications. Okay, so we don't want to use ibuprofen. So that's like your Advil and your Motrin under like 6 months old or under. So you're going to want to use acetaminophen. I like the Genexa. I don't have like an affiliate with them or anything. I'm not getting like paid to say that, but it's a pretty clean brand that doesn't have the yucky dyes and stuff in it. So if you want to use some acetaminophen for fever, definitely reach out to your pediatrician because the dosing may not be on there appropriately for your child's age. And you'll want to make sure you're getting the right kind and everything. Okay. On that, if you're a Middle Path member and you're using acetaminophen, please reach out to me because I want to talk to you about using possibly some glutathione support depending on your kiddo's age. Okay, so and that's for liver support because acetaminophen goes through the liver. So we want to talk about like detox and all of that. But that's another episode. But if you're a member, reach out to me about that. Okay, what else do I want to talk about today? I want to actually touch on a few foundational nutrients. So first of all, y'all, it is super easy to do the ice cream and the cake and, anything your kid will eat. But if you can just stay to whole foods that are organic if possible, at least not like super high sugar junky foods, that really supports the immune system and helps decrease inflammation in the body overall. So that's kind of the basis of everything. Now, beyond that, giving vitamin D, 400 IU for babies, 600 IU for 1 year. And then older kids probably going to be closer to 1,000, but you can reach out about that. And then omegas for baby 6 months and up. I like to use DHA, either the vegetarian or the fish, depending on if you have any dietary preferences or the needs of your baby. And you can get different kinds depending on your child's age. Very supportive for the inflammatory balance in the body. And then vitamin C. So we want to make sure that foods for that we're giving vitamin C in appropriately for the different age groups. Let me try and get that straight. So vitamin C is a good antioxidant, helps with inflammation in the body. So in babies, I think it's much better to not feed vitamin C as a supplement to them. So like a year and under, because vitamin C is quite acidic, so it can be not very gentle on their tummy and they get upset tummy. But if you have a baby 6 months and older that's eating purees and is tolerating a little bit of citrus, you could do a little bit of citrus food throughout the day. And if you're a breastfeeding mom, you can definitely take like 1,000 milligrams of vitamin C yourself and see if that helps support your baby too. But please don't just feed like a lot of vitamin C as a supplement to your baby because they're not going to feel very well. I'm going to give this one 5 stars. This is a 5-star review. Elderberry, 5 out of 5, I should say. 5 out of 10 wouldn't be very good. Maybe I should say 10-star review. I don't know. Anyway, elderberry syrup, you guys, I love this for flu. It has really amazing antiviral properties. It's great if you can use it in the first 48 hours. So you want to get started on it quite quickly. It's a syrup. It tastes good. Kids love it. Gaia makes a great one. There's plenty of ones on the market. If you want a discount on it, sign up to my full script. We'll link that. You do need age-appropriate dosing, so make sure you check the bottle or ask your pediatrician if your child's age isn't on there. And it has, if you want more details on it, there's like research to show that it affects the hemagglutinin part of the reaction of how like the influenza virus binds to the cells. But essentially, it's very antiviral. It's a great one to use. Okay, again, we're not using this in like little babies, so make sure you check in about when it's appropriate with your holistic pediatrician. Ginger tea, this is great for nausea. It's great for nausea, you guys. Like you may have to do, for kids over a year, you may have to do a little honey, agave, that kind of thing, just to help with the flavor, because sometimes it can be a bit spicy, but it does really help. So sips of ginger tea, if you can get it in, it really helps with that nausea and inflammation as well. Same with chamomile tea, also great. The flavor's kind of, I don't know. Again, kids over a year, you could do the honey. It's very calming, helps with sleep, helps with fussiness. For little babies, there's also a homeopathic camellia. It's branded actually for teething, but I like it for kind of anything that needs calming in the body. So that would be something appropriate to use in little babies. Okay, so syrups, these are great for cough, not the yucky kind. We don't want to get up in any kind of like yucky pharmaceutical, like all kinds of dyes and chemical type syrups. What I'm talking about here is for over a year old, we can do like honey-based syrup or like a thyme-based syrup, and that really helps to calm coughs, coat the throat, helps with postnasal drip. I really do not like other types of cough syrups. They don't really, in my experience, help. So not only that, they have all kinds of things in them. Homeopathies. So let's see if we can work out how to say this word. Oscillococcinum. 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 That is wild, you guys. To this day, I still think we should shorten that. Maybe we can just call it Oscillo or something to make it cuter. Anyway, it's a homeopathic remedy, which aren't miracle cures. There's good safety data. Studies are kind of mixed. I think it's worth a try. And they come as little tablets. So for little ones, you'd have to like dissolve the tablets appropriately and dose appropriately. So you'll want to reach out to your holistic pediatrician about that. Okay. All right. Pharmaceutical medications, AKA Tamiflu. There's other ones out there, but this is like the big one. So that's what I'm going to talk about today. The generic name is like oseltamivir. No one can say that. So we all say Tamiflu. If you are going to use this, you guys, you really have to get it in your child within the first 48 hours. Day 4, day 5, it's not going to do anything. So no point in getting a prescription for it at that point. When do we consider using it? In an infant. You guys, if you have an infant with the flu, we do consider it because infants often get complications from the flu. Kiddos that have immune diseases, chronic illness, asthma, heart, lung, things that they could get severely ill, and we would consider using the Tamiflu. There are some side effects, which is why I don't necessarily always use it, like nausea and vomiting. And as we know, we're already probably nauseous from the flu. So sometimes kids will actually throw this up. Yeah, that's what I'll say about that. We can dive into it more at your visit, you guys, if your kid gets the flu. There's a few other little finer points that I would want to talk about with the Tamiflu, but I want to leave this episode around that 20-minute mark because I know y'all are busy, busy parents. Okay. When to run to the ER? Okay. If this is I'm laughing because this is just a common question, not because of the seriousness of this. But if your kiddo is having difficulty breathing, they're breathing rapidly, they're having retractions, which is when you can see their ribs when they breathe, heaven forbid, their lips are turning blue, their face is turning blue. If you're seeing distress like that, please call 911. Okay, now the rapid breathing and such and a little bit of retraction, maybe you can just drive them to the ER, but heaven forbid, we're turning blue, we're actually not breathing, we can't breathe, please call 911. Lethargy, we're talking about medical lethargy with this one. Most kids with the flu are going to be pretty tired, okay? But when we talk about medical lethargy, this is they won't wake up to interact with you. They won't play with you at all. And when I say play, they're going to be sick, but just a little bit of interaction. They won't drink water. You just can't get them awake. That's not okay. That's ER 911. Persistent vomiting. If your kid is vomiting so much that they're not able to keep fluids down, they're getting dehydrated, they need IV fluids. So please take them to the emergency room to get evaluated for that. They may need blood work. Those are emergencies. And then chest pain. Depending on the severity with the chest pain, you're going to need to seek some kind of urgent medical attention, whether that's with your holistic pediatrician or your urgent care or ER, depending on the severity of the pain, you'll be able to judge that. And then another reason to seek care, and I would recommend starting with your holistic pediatrician for this, is if your kiddo is kind of doing better with their fever, and then all of a sudden the fever comes back. And you're like, wait, I thought the fever was gone. You just want to check on that to make sure they don't now have a secondary infection like pneumonia or something else, like an ear infection, all of those things. And trust your instincts, you guys. Mommies, daddies, parents, grandparents, caregivers, you guys know your kid. So when you feel that something's not right and your little kind of spidey senses are going off, have them looked at, okay? It's perfectly fine. We're more than happy to do it. All right. So if you are listening and you're thinking, I wish I had a pediatrician who would walk this through with me in real time, you want to know more about holistic care, please go to my website, middlepathintegrativepediatrics.com, middlepathintegrativepediatrics.com, and hit that meet and greet button. I would love to talk to you about joining the practice. If you haven't joined my newsletter already, you can do that on the same page, and I would love to talk to you more. I give out valuable tips weekly, and this week was all about the flu. So I'm wishing you guys well. See you next time. Bye.